Hello everyone, today we learn about the fontanelles. In an adult skull, these are the different bones. You have the frontal, parietal, occipital, temporal, and the greater wing of the sphenoid. Between these, you have very important sutures. This is known as the coronal suture because it runs in the coronal plane, and this is known as the lambdoid suture. Let us have a look at this skull in a vertical view. It is called the norma verticalis or the superior view. So in the norma verticalis, I hope you can identify the frontal bone, the two parietal bones, and the occipital bone over here. Between these, you can again spot the coronal suture and the lambdoid suture. And between the two parietal bones, you have a suture over here, and that is known as the sagittal suture. With this understanding, let us have a look at a fetal skeleton to understand where these fontanelles are. So in the fetal skeleton, you can again notice the frontal, parietal, occipital, temporal, and greater wing of sphenoid. But you can also note widened sutures, as also you can notice fibrous membranes spanning these areas. These are known as fontanelles. So this is known as the anterior fontanelle. This is known as the posterior fontanelle. And you have two small fontanelles as well. This is known as the sphenoid fontanelle or the anterolateral fontanelle, and this is the posterolateral fontanelle, which is near the mastoid. So it is called the mastoid fontanelle. Let us have a look at this same in the vertical view, just like you saw in the adult skeleton. So here you can see the coronal suture. Here you can see the lambdoid suture, and between that, this region is the anterior fontanelle, and this region is the posterior fontanelle. Here you can see an additional suture separating the two frontal bones, which is seen in the fetal skeleton. This is known as the metopic suture. So note that in the fetal skeleton, you have the anterior fontanelle, which is diamond shaped because of an additional metopic suture over here. And you have the posterior fontanelle, which is triangular in shape. Note that these fontanelles will close to form the bregma over here and the lambda over here. So anterior fontanelle corresponds to bregma and posterior fontanelle corresponds to lambda. Why is this clinically important? A bulging anterior fontanelle can be seen in an increased intracranial tension. It can be seen in hydrocephalus and also important conditions like bacterial meningitis. Brief temporary increase can be seen when the child strains for stools or coughs or vomits, but it will descend back to the normal contour. A sunken anterior fontanelle can be seen in dehydrated states. Also, if the anterior fontanelle is delayed in closure, it normally closes in the second year of life in 18 to 24 months. But if there is a delayed closure, it can point to deficiencies in ossifications. Anterior fontanelle is also the neurosonographic window because if you place an ultrasonic probe, you can actually view the interior of the brain in a neonate. The other fontanelles, that is the sphenoid fontanelle, the posterior fontanelle, and the mastoid fontanelle, can also be used as additional windows by which you can do neurosonographic examination. Thank you.